Have you ever had difficulty with coughing and mucus and phlegm? One of the things that we want to discuss today is that there's two types of coughing techniques that will really help you get the phlegm out. The first one is a deep or a direct cough, and the second one is a huff cough. Now, mucus and phlegm is so common in pulmonary patients, whether it's COPD or pulmonary fibrosis or asthma. Any of those conditions, people can struggle and suffer with congestion in their chest and they have to cough. And we want to try to get that phlegm or mucus or sputum, it's all the same thing, out of your lungs. So the way that we're going to do this with the coughing techniques, what we're going to do is, the first one, like I said, is a deep or a direct cough. You're just going to take a breath in, hold it. That's a regular cough that everybody kind of knows. You want to inhale deeply, take a nice deep breath in, enough that you don't start coughing, and then exhale forcefully with an open mouth, trying to clear the mucus. That's a direct cough. Now the second one is a little more challenging. It's called a huff cough. And what you're going to do is, you're going to take another deep breath in and hold it, and then on the way out, I want you to try to say the word hot without the T, so it's a ha sound. So it sounds like this. You breathe in, you hold it, and then another breath in and hold it. You want to breathe more from your stomach than your throat. And what that's going to do is it's going to get a lot of air down underneath the phlegm and push it up and keep going. You do a couple breaths like this, and then if it gets stuck, then you can do a direct cough. So you do one more huff cough, and then you can follow it with a direct cough or two. These are the different types of cough, whether it's direct or huff. Now, what we want to do is focus on the mucus clearance, because these techniques help mobilize and remove the mucus from your airways, promoting really good lung health. And why are the different coughing techniques used? Because we want effective mucus removal. Each technique serves a different purpose and can be recommended based on whatever your condition is. So if you're having a situation where a really hard cough with a direct cough puts you into a coughing spasm, then you don't want to do that. And so maybe a huff cough would be better. Each person is different. So the first thing I would suggest is talk to your doctor and then also try these and see which one is the most effective. In terms of people doing them, it's, COPD, some pulmonary fibrosis, cystic fibrosis, any of those conditions, and sometimes even people recovering from surgery have to get the cough and get the phlegm out. I know I'm asthmatic, and sometimes after I use my inhaler, it will loosen the phlegm because it's almost like a cork trapped in a bottle. So you have all this phlegm down here, but your bronchial tubes are tight. You take your inhaler, it opens up, and now the phlegm can come out. And people will say to me all the time, David, I don't understand. Why am I coughing after I take my inhaler? And that's usually why. Now, one of the things that I want you to focus on is not overdoing it, because there's a tendency to really push and exhale forcefully. Don't do it. Just do it gently to start off with until you get the proper results. And the whole purpose of this is to clear the phlegm, because phlegm is a naturally occurring substance in your body, because your body makes this wet, slippery blanket of mucus as it's cleansing your lungs. And then we want to get it out. And sometimes when you cough, the phlegm comes up, it sticks to the side of the bronchial tubes, the airway is restored. Sometimes it comes up and you can spit it out. One of the other things we want to talk about is the 4 classifications, if you will, of mucus. So it's color, odor, texture, and amount. And if anything changes with those, that's when you want to talk to your healthcare people and tell them something's going on, whether I'm not feeling well. Is my phlegm kind of green or brown? Because that could indicate infection. But coincidentally, it could also indicate something that you ate prior to that. So that's okay. Also, in some cases, these techniques may not be suitable for you. such as people with certain heart conditions or fragile rib cages. If you cracked a rib or you're having any issues like that, that they will cause comfort or exacerbate any underlying medical issues by really forcefully coughing. Always consult with your healthcare provider to make sure that doing certain direct or huff coughing techniques are appropriate for your specific situation. So focus on the two different types of coughs. Practice it, try it, leave some questions down below if you have any, or if you want further clarification. Practice these, try these, don't overdo it, but do it. Have a great day. Thank you so much for watching this video. I'm really excited to share this because this is part of our new instructional series. So if you've learned something and have enjoyed this video, please consider giving it a thumbs up and subscribing to our channel. We would love for you to share how this video helped you and leave a comment below. Tell us what you would like to see next. I really love to read your comments. I love to hear from you. And the most important thing is I'm really honored to be able to help you. Have a great day. I'll see you in the next video.